Thank you for joining me on this episode of Robyn Makes Sense, where tonight we're going to discuss your numbers. Do you know your numbers? And by numbers, I mean your blood pressure, your cholesterol, and your heart rate or your pulse. So we're going to discuss these three numbers or these three sets of numbers and what they mean and what that means to you, your health, or your loved ones, and ways that you can either, increase or decrease these numbers depending on what they are and what they mean. So we all go to the doctor on a regular basis and or should be and we all have heard, they take your blood pressure immediately. When you get blood tests, they take your cholesterol and they take your heart rate or your pulse. And a lot of people today even have on their smartphones these little watches that take your pulse, or like fitness bands that take your pulse and your heart rate. And what does all this mean? Why do we need to know these numbers? Why should we be checking them on a regular basis? What does it mean for our health? What does it mean for our livelihood? So we're going to get started today. So, blood pressure. Your blood pressure measures the force that your heart uses to pump blood. That's pretty much what it is. Your cholesterol is made by your liver. It's a waxy fat-like substance, and it's in all of the cells in your body, and it helps in digesting your food, producing hormones, and the generates production of vitamin D. Your heart rate or your pulse is the speed of your heartbeat. So basically, it's your contractions or beats per minute. So these are the three items that we're going to go through today. First one is your blood pressure. So we all know now that we know what blood pressure is, when you go to the doctor, the first thing they do is take your blood pressure, right? And this is an important step because this measures how hard your heart is working. So if there are any warnings that you're having, difficulty, your heart's function is to pump blood to the rest of your body and your brain, and base oxygenated blood to your body. So your organs and every aspect of your body functions on oxygenated blood. It's used to repair things. It's used to, um, you know, bring life to your body essentially. So your heart is a very important. So your mind is pretty much the controlling of everything, where your heart is kind of like giving everything the gasoline to work essentially. Because without it, you would not be alive. So that's one of the major organs in your body that you need to function daily, and you want to keep it in good shape. So it's a muscle. Its average heart is usually the size of your fist, and it's made up of four chambers. So on this, the valves in your heart open and close, and they move blood through the heart and into your lungs, and then it gets oxygenated and so on. So I'm going to go through the four different chambers just to give you a little bit of why the heart, what its function is, and why it's important. So your heart, the first chamber is the right atrium. This receives blood from the veins and pumps it to the right ventricle. So then the right ventricle receives blood from the atrium and pumps it to the lungs, which is where it becomes oxygenated. And then from the left atrium receives that oxygenated blood from your lungs and pumps it to the left ventricle. And then the left ventricle, which is the strongest chamber of your heart, is what pushes the blood out to your body. So that left ventricle is pretty much where you get your blood pressure from. How hard is that left ventricle pushing the blood outside your body? And if it's too high, if there's too much, if it's working too hard, that means that there's something, something somewhere is causing a problem, and that's when it becomes a red flag, and you want to make sure that you don't want it working too hard. So your heart beats about 60 to 100 times per minute, which is about 100,000 times a day. That's like, that number is pretty, think about it. Like your heart beats on its own about 100,000 times a day. Like it's just, it amazes me. Sorry. I know I can geek out a little bit with this stuff. Um, on its own with no electricity. Just stuff fascinates me. So now let's get into what is your blood pressure. So now that you have an idea of what goes on with your heart and what the role is, and the whole point is you want to get oxygenated blood throughout your body, through every organ, through everything in order to function. And that's your heart's purpose, is to pump it out and get it there. So your blood pressure is how hard is your blood, is your heart working to pump it out. It's a muscle, so like muscles, the more you work it, the stronger it will be. So let's go to blood pressure. You have your top number and your bottom number. So usually your top number is your systolic number. This is the pressure on the artery wall during the contraction. So when the left ventricle is pumping that blood out, this is the pressure against the artery wall. That's the top number. So how hard is it pushing? The bottom number is your diastolic number. This is the pressure on the artery walls between beats. So your heart pumps out the blood. That's the top number. And then it stops for, between beeps, like this boom, boom, boom. So when it stops, it fills up with blood again. So so basically when it's resting, how much is of the pressure is how much has it got to work to fill that up. The normal blood pressure is 120/80. Now this number can vary by person. I know with me personally, my blood pressure is usually 110/70. So you want to gauge your numbers based on what you normally are. So for 110/70 is considered normal for me. Very rarely do I go to a doctor and have 120/80. If I do, that's a little bit high for me. Pretty much my whole life, it's 110/70. And so that's a base number that you should know. And or your doctors can certainly see the history and knowing what number is your number. So that's an important number to know. Now you want to make sure that that number, that top number and bottom number, do not exceed certain numbers, or you're considered to be hypertensive. And if those numbers, and now there's variables throughout, there's various stages. There's hypertension stage 1, stage 2, but the main numbers to be concerned with are if the numbers are above 180/120. So if that top number goes above 180, or that bottom number goes above 120, you should be calling your doctor right away, letting them know that your numbers are that high, and they may want to see you, or depending on your medical conditions, they may recommend that you go to an urgent center or an ER just for some further testing to make sure that everything's okay. If you does not mean that you're having a heart attack. I don't want to scare anybody, but it just means that your heart is pumping. Like I said, it's pumping harder than it should be, and there could be something going on. There could be other factors, which is what they would want to rule out, but you just want to make sure that your doctor's informed and that they can guide you on the next steps that you should be taking, because that is considered being hypertensive. If your numbers are 90/60 or below, that's considered hypotensive, and that's a low blood pressure. And that doesn't necessarily mean that it's an extremely dangerous. If it gets too low, yes, it can be life threatening, but it's not necessarily dangerous right away. But if your numbers stay low for a significant period, you want to monitor them. And if they keep dropping, further below the 90/60, you want to let your healthcare professional know, whether you go to an urgent center, you call your primary care doctor or your cardiologist, or whatever the case may be. And you should also be checking that the blood pressure every time you take your blood pressure medication or you're giving it to your loved ones. So my mom was on blood pressure medication and we had to take it every single time we gave her that pill. And the doctor instructed us that if her bottom number was 55 or below, we should not give her that pill because it would cause her to have too low of a blood pressure, which could be dangerous in itself. Now, high blood pressure, um, things that affect high blood pressure. So your diet is key factor pretty much in everything in your body. Your diet, what you eat, you are what you eat, which we covered in previous lives. If you're a smoker, that can cause you to have high blood pressure. Your weight, if you're overweight, or even sometimes underweight, can cause a strain on the heart. So your weight is a factor. If you don't get enough exercise, so they ask you to do 20 to 30 minutes of cardio a day because, like I said, the heart is a muscle and you want to keep it strong. You want to keep it going. You want that pump because the stronger that your heart is, the less it has to work. So when you have a strong muscle, right, and you push something out, you don't have to push as much with as much effort. If you have some, think about it, some guy in a gym, right, he's all muscles and everything like that. When he pushes something and I push something, do you think that we need to use the same amount of force? No, I probably need a lot more force than he does to move the same item to a certain degree. So you got to think of the heart that way as well. Like the stronger it is, the less it has to work, which is good, which is a good thing because you don't want it to work too hard because then it causes other issues. Okay. So, um, other things that cause high blood pressure, sleep apnea, which is actually such a high statistic of people that are undiagnosed sleep apnea patients. For some reason, people don't like getting diagnosed. They don't like sleeping with machine. And there's a high number of patients that have sleep apnea that die from a heart attack because of this, because not getting enough sleep actually plays, or not getting depending on your severity of sleep apnea, it could cause you to have a heart attack. You're not getting, your body's not functioning properly, and it's your body has its way that it needs to function, and if you're not following the rules essentially, then you're gonna wind up in trouble. Stress is another factor with high blood pressure. Absolutely. Stress is so bad for your body on so many levels. And it absolutely, and the reason with stress, your body gets into like a flight or fight mode, and it produces certain hormones that shut down parts of your system that give you some other hormones with like adrenaline, and if your body doesn't have, which is fine in that fight or flight mode, if your body needs it, like if you're being chased by an angry wolf that's coming to get you, you want to be stressed because you want that adrenaline to push and give you that extra. But when you stop and you relax and you breathe, then your body can calm down. There are some people that are at that high level of stress that they don't let their bodies come down from that level of stress, and it cause your body's not made to stay in that high level fight or flight mode, and this is what happens, and this causes problems for people on all different levels: digestive issues, reproductive issues, cardiac issues. Like there's just so many issues that it causes when you stay at that level, but that's another whole discussion. um so the next topic is that we're going to go into is oh, sorry, low blood pressure. So low blood pressure is often caused by medication, certain medications obviously that lower your blood pressure. Dehydration is probably a huge part of people that have low blood pressure. When you think about it, so your body, your blood is made up mostly, your blood is water based. So if you're not getting proper amounts of water in your body, right, your blood is going to get thicker. And do you think that will move faster or slower than blood that's got a lot of water? It's thinner. So thinner blood, like with that's got the proper amount of water, is going to flow more freely and nice. Whereas something that doesn't have as much water and it becomes thicker is going to flow slower. and therefore that's going to make the heart, like that's gonna cause issues in itself, because there's not, the pressure is going to be low, because there's not, like, if we talked about the four chambers, and it has only a matter of, what, milliseconds to fill that heart up before the next beat, before it's got to get pushed out. So you'll have low blood pressure because you won't have as much blood pumping out, because it's not filling up fast enough. So the blood pressure will be low. So that's one cause for. So dehydration. Make sure you drink your water. You should be drinking half your body weight in water in ounces. So if you weigh 200 pounds, you should be drinking 100 ounces of water a day to sustain your hydration. Just FYI. Um, Heart failure. If somebody's in heart failure, that causes low blood pressure. The heart's not is failing, so therefore it's not going to be strong. It's not going to be pumping out. It's going to be too low. Sometimes women that are pregnant, they can have low blood pressure, because it could be stresses on the body, and you usually monitored by a doctor. People with chronic illness such as multiple sclerosis or Parkinson's, they could also have low blood pressure because of their illness, as a direct side effect from their illness. So you want to check your blood pressure. If you have a chronic illness or you're taking blood pressure medication, you should be checking it on a daily basis, so that what's going on. If you shouldn't, you should absolutely be taking it before you take your blood pressure pill, to make sure that it's not going to drop too low, which could be dangerous. But if you're the average adult, and you should check it every so often when you go to, like, I know that sometimes the CVS and the Walgreens and the Walmarts, they have those machines, and you just sit there and you check your blood pressure, you check it, or just every once in a while. I'm not saying go out and buy a machine, although it doesn't hurt to have one in the house if you're ever feeling like stressed, or you're feeling, sometimes people may get some pains or something like that. Check your heart rate, see what's going on. High heart rate doesn't heart blood pressure does not necessarily mean you're having a heart attack, but it can let you know that something's going on, that you should be seeking medical help if it's regularly high. Okay. So the next item on our list is cholesterol. So you have two types of cholesterol. And your cholesterol, you have low density lipoprotein, and that's your LDL, or often known as the bad cholesterol. And then you have high density lipoprotein, which is your HDL, or often referred to as the good cholesterol. And you want your, so when you often go to the doctor and you get your cholesterol tested, they'll give you your total cholesterol number. You want that cholesterol to be below 100. So the normal range should be below 100. I think it's between 150 and 200. If it's between 200 to 239, that's considered borderline high cholesterol, and you should consider taking some steps to maybe change some of the things in your diet, or speak to a doctor. If it stays within that range, maybe there's something going on. Maybe there's a genetic factor, because genetics do play a role in how high cholesterol can be, and you just want to monitor it. Once it exceeds 240, that's considered having high cholesterol. And usually doctors, depending on your medical history, oftentimes will ask you to start changing your diet to see if you could bring it down naturally, or they'll consider putting you on medication. But again, that all depends on your medical history. But once it's over 240, it's considered a red flag, and you want to watch that and make sure that it doesn't get too high. And now we're going to go into why. What do those numbers mean, and why do they, good versus bad? What is that even? So your LDL, or your bad cholesterol, it creates cells. And so you have cholesterol in every cell in your body, and it makes up some of the structure of the walls within your body. So just wanted to start with that. So the LDL, the bad cholesterol, it does have some good functions, but it's the one that's harmful to you if there's too much. So this creates, it helps create cells and hormones, and also helps with the generation of vitamin D. Too much of this LDL bad cholesterol, so it basically is in the structure of your wall of your walls, right? So too much of it, because if it's too much, it hardens. Because, like I said earlier, blood is water based and cholesterol is oil based. So it does not mix. It doesn't mix well, so it's always separate in your bloodstream, and it sticks to your artery walls. And it too much of it causes narrowing of the pathways. So if you have too much and they're all sticking to the sides of the walls, and the blood's trying to flow through, and it's got to go through smaller and smaller and smaller paths, that's also going to increase your blood pressure because the blood is not flowing as much. And then if you have a full blockage, well, now that's usually when people require emergency surgery or causes a heart attack because the blood is not properly flowing. It's blocked. And that's where you'll hear that people have like a stent or something put in because there's too much plaque built up on the artery walls. Like it's a full blockage. It's plaque and cholesterol. And um, your high cholesterol also aids in stroke. So it can help. It aids in the blood clotting process that can cause someone to have a stroke. So it doesn't create blood clots, but it can help. It can, if you have too much of it, it can aid in that process of creating a clot that would ultimately cause someone to have a stroke. So it's another reason, people that have high cholesterol are at very high risk for heart disease and high risk for stroke. So a lot of stroke patients will go on cholesterol medications just to manage that, to avoid, which are usually blood thinning medications for high cholesterol as well. Okay, so then the LDL, or the bad cholesterol, should be below 100. And if you're 100 to 129, it's something to watch. Once you get to the 130 to 159 range, that's considered borderline high. And then if you are 160 to 189 or higher, that's considered dangerous. That's considered high cholesterol. And that's when a doctor would intervene and discuss options with you, whether it is part of genetics, whether it is your diet, and usually want to work with you to manage that. Now, the HDL, which is your good cholesterol, this cholesterol removes other forms of cholesterol from your bloodstream and brings it back to the liver to get flushed out of the body. So your HDL, your good cholesterol, helps get rid of the extra bad cholesterol. So you want to decrease your LDL, your bad cholesterol, and increase your HDL, which is your good cholesterol, because that helps get rid of the bad cholesterol. So that's always, good thing. Now, your HDL, that number should be above 60. And if it's below that, you should work on ways to increase it, because that you want to help. Because if, in you're going, there are going to be certain times in life based on what you eat that your cholesterol may go a little bit higher. But if you have a good amount of the good cholesterol, the HDL, it's going to pull out all that excess bad cholesterol so that you're not getting you're not at risk. So it helps manage it. To increase your HDL, you want to have a heart healthy diet. So things that are very high in fiber, oats, beans, nuts, vegetables, things like that. High fiber is good HDL. Like, I know that there are times where, I've been told by many doctors that if you have high cholesterol, go on the 30-day oatmeal diet. It helps reduce it. And it really does. And this is why, because that's a high fiber. I'm not talking about the sugar oatmeal. I'm talking about real, like, straight up, non-sugar oatmeal, like not the old-fashioned oatmeal, not, the instant, let's throw in a microwave oatmeal. That has way too much sugar in it for it to be having the good effect. So often doctors say that for 30 days do that, and it usually brings cholesterol down, because it does, because you're increasing your good cholesterol, which helps get rid of the bad cholesterol. So to reduce the bad cholesterol, you can control it by your diet. So limiting foods that are high in saturated fats or trans fats, animal foods, meats, cheeses, these are all things that are high in cholesterol. Now, if you don't have a cholesterol problem and this is just something that you want to balance, so eating things in moderation and then balancing it out, that's a good way to do that. So if you do eat things that are slightly higher in bad cholesterol, make sure you have some things that are high in good cholesterol to kind of balance it out, right? So in moderation, don't go too much one way or the other, and then you have a good balance. Okay. So adults over 20 should be getting their cholesterol checked every few years, every, 3 to 5 years in general. Obviously, the older you are, or based on your health conditions, if you're somebody who's over 50, and let's say you're overweight, or you know that you don't eat a very good diet, or you have bad genetics in your family, then you may want to get it checked on a regular basis, maybe on an annual basis. You go for an annual checkup, because then you can keep it at bay before it gets out of control and before it can cause you some harm. Um, but most doctors do test that on a regular basis when you go in there. When you go for routine blood work, your cholesterol is usually one of the things that they do test because of it. Because if they keep it, they monitor it, it actually does create, prevents having some serious issues going on. So the next topic we're going to discuss is your heart rate. So you may know your heart rate also as your pulse. So your heart rate, you take by counting the number of beats in 60 seconds. So usually, by your neck, by your wrists, you can take it back of your legs. There's a bunch of places that you can take your heart rate, and there are a lot of, like, these smartwatches have where they check your heart rate regularly, or these fitness bands. I believe some smartphones even have apps that you put your finger on it. It can check your heart rate or your pulse. And the reason why you check your heart rate is you want to just make sure that you're not having palpitations, which is when it's beating too fast. The goal is to have a low resting heart rate, because that means that measures how strong your heart is and how much it has to work. So the average heart rate is about 60 to 100 beats per minute. And if you are somebody who's athletic, or you're a runner, you exercise frequently, your heart rate will probably lower, as in the 40 beats per minute range. Usually very athletic people are have a lower heart rate. And that's not saying that your heart's not beating. It's just saying that it's not beating as quickly. So when you listen to your heart rate, it's like boom, boom, boom. And when you get excited, or nervous, your heart rate increases, like boom, 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 boom. So you want to it's beating fast. So active people have a low resting heart rate, which is pretty much what you want. So your maximum heart rate is 220, and there are people that have gone above that number, but usually your max heart rate is 220 minus your age. Sorry. It's 220 minus your age. That's your formula. So if you're 30 years old, your max heart rate would be 190. Is it possible to go above that number? Yes. Is it dangerous to go above that number? Yes. And it's not recommended. So you don't want to push yourself to the point where your max heart rate, um, and it's not common that people can push themselves that hard where their heart rate goes above that. And it's definitely not something to play with, because um, you can put too much strain on your heart and cause a cardiac event, which you don't want to do. Your heart rate is also very easily affected by things like medication, by stress, by your age, by your fitness level, your body size, emotions, even your body position. So for example, if you're laying on the left side, your heart rate will be lower, because gravity is pulling your blood, and therefore it's flowing more freely, and your heart has to pump less. I did a video on that, about sleeping on your left side, and how that helps with lower your blood pressure at night if you sleep on the left hand side, because gravity kind of helps pull the blood through, so it's less that your heart has to do. So things like that all affects your heart rate. Your temperature affects your heart rate. So your heart pumps. This was interesting to me. Your heart pumps faster in higher temperatures. So if it's very humid, or it's very hot, your heart pumps faster. That was interesting. I didn't know that, and that was cool to learn. And if your heart is ever beating too fast, um, uh, and you feel dizzy, or you feel faint, that's when you would call your doctor, because something may not be going on, something may be going on, and you want to let them know, especially if you feel faint or you feel dizzy. Your high heart rate is called a palpitation. So if you're having a palpitation, which is it's beating too quickly, and you're not exercising, or you're not doing something that's causing it, maybe it's stress or something else, taking deep breaths can help manage that. It can bring it can help lower that heart rate. By taking a deep breath, kind of relaxes the body a bit, and therefore, I generally tell people to do the count to four. So you take a deep breath in while counting to four, hold it for 4 seconds, and then let it out while counting to four. And doing that a bunch of times, let's say 4 times, let's start with, um, that can help relax your body and your heart, and bring your heart rate down. Um, you can also splash cold water on your face. So your cold water on your face stimulates the nerve that controls your heart rate. So it's the same nerve that runs down from, goes to your heart's right here, your face is here, your brain is here. So it kind of passes through. So by using cold water, it kind of stimulates it. It gives a little bit of a shock, like it wasn't expecting it. And therefore it kind of wakes it up like, hey, what's going on? Make sure that you're checking on my heart rate right now. And also, sometimes exercising can help. Now, if you're having chest pains and your heart's beating fast, do not think, let me get on a treadmill. No, call 911 or get to an ER, because there could be a cardiac event going on. But if you're sitting there and you suddenly have, a rapid heartbeat, maybe you're a little bit stressed out over something, you're worried about something, getting on a treadmill or exercising, or just jogging in place, or getting up and moving around, just bringing your heart rate up a little bit, could help balance it out and keep it in check, and figure out what was going on, and then cause it. And then, just for a few minutes to get it in sync. And then as you relax, it'll come down as well. So those are my little tips and tricks, and going over um, these numbers. So, you want to make sure that you monitor these numbers, because they're very important to your overall health. And there are people I know that keep logs. We used to keep a book for my mom and write down her numbers every day, just to know if there were patterns, when we went to see the doctor, or if something was going on. And they would look back and say, hey, what has her heart rate been on average for the past week or so? And we could say it's been stable, or, oh, hey, it spiked these few days, but then it came back down. To Because patterns will often tell the doctors what's going on in your body. Your body is a way of warning you when things are going on. Um, and you want to listen to it, because it's important. When you don't listen to your body, things are going to go wrong, and then emergencies happen. So you want to listen to your body, and make sure that, your body better than anybody else. It's your body. And there are times that I've gone to a doctor, and the doctor's like, you're just being, like, they'll dismiss something I say, and I'll say, no, I know something's going on. I want further testing. And sometimes it turns out to be I was right, and sometimes it turns out to be I was wrong. But you know what? All I need to be was right one time, and they dismissed it, and I didn't push forward. That's it. And something worse happened. So you know your body better than anybody. I'm not saying go into your doctor's office and start asking them for, you know, garage of tests. I'm just saying, if you know something's not right, and your doctor's not listening, explain to them in a way that will make them listen. And if they still don't want to listen to what's going on, then you should find a new doctor, because that's very important. A good doctor will listen to what their patient is saying and consider it. And there are plenty of times where people get misdiagnosed because they just say, hey, my doctor said this, okay, I'll just accept that. But they know in their gut that something else was going on, and they didn't push forward, and it led to an eventual bigger problem. um so, with any sort of cardiac, if you have any sort of cardiac events going on, if you are a heart patient, these numbers, and the variations of them, you would want to check with your doctor. So this is just for this list was pretty much just for the average adults, and these are the guidelines that you should follow. But obviously, if you're being monitored by a cardiologist or primary care physician, and they tell you your numbers should be within this range, by all means, that's what you should be. That's the goal you should be attaining, and those are the things that you should be listening to, and you should be consulting with your doctor before you change anything. Of course, you just want to make sure that your health and and your gut and listening to your what's going on in your body, it all kind of makes sense. And if anyone has any questions, I'm certainly willing to answer them. Let's see, we have diabetes, diabetics experience heart attacks. So that's true with many of the with many chronic illness, people have a variety of symptoms. And again, if you're being treated by someone, by a primary, for diabetes or for heart disease, or like, you want to listen to your doctors and go by what they're saying, because they'll tell you what things you should be looking out for. So this live was more an explanation of, hey, these are the numbers that you get and what do they mean. By no means am I saying that this is what you should be following, especially if you're under doctor supervision, because if you have certain genetic markers or you have certain factors going on in your medical condition, your doctors will tell you. They may want to know if they may call you in if your cholesterol goes up to a certain number that may seem normal to others, but in your case, it may be a dangerous situation. So again, these are just some baseline numbers for the average adult. You want to make sure that you are consulting with your physicians. So I just wanted to mention, for those of you that are joining and have not signed up yet, we are doing a caregiver webinar. It is free for caregivers every Wednesday. And you just sign up at caregiverwebinar.com, and we're doing educational sessions, going over topics for caregivers about being prepared or patient safety, financial strain, self-care, things like that. So if you are a caregiver, or if you would like to just get some extra education, we're happy to have anyone on. If you're caring for somebody who's elderly or has special needs, sign up at caregiverwebinar.com and join us on Wednesday.